Hey everyone, Sarah Strackhouse here. I'm keeping it a little bit quiet because we're in a very special room for this live with Dr. Alfred Johnson with Johnson Medical Associates. Dr. Johnson, can you tell us where we are right now?
Yes, we're in the Hyperbaric Center here at Johnson Medical Associates called Hyperbaric Centers of Texas. And in this area we have hyperbaric units that we treat patients with all kinds of variety of injuries that they have received or incurred throughout their life, and hyperbaric helps with the healing.
Yeah, and so tell me about these chambers. We're standing in front of a hyperbaric chamber, correct? Or what is the technical term for that?
That is correct. Oh. It's a hyperbaric chamber.
Okay.
These are hard-sided chambers, which are chambers that are traditionally used in medicine to treat the bends, which is diving accidents where you have to surface quickly and where you accumulate nitrogen in your tissues and causes all kinds of joint pains, neurological symptoms. And in that condition, then you're put in the chamber, it's pressurized, you're breathing 100% oxygen. There's a whole protocol over hours that you go through to decompress again.
I see.
And it allows the nitrogen to slowly dissipate from your body. In medicine, we use it for all types of other types of healing. So traditionally, it's been used for diabetic wounds that are non-healing, acute carbon monoxide exposure, near drownings, acute hearing loss, some crush injuries type situations. And then there's a whole host of off-label uses. And that there's a whole list of those, but that can be from autism to cerebral palsy, which are in kids, to head injuries, concussions, traumatic brain injuries, encephalitis, whether it's from bacteria or from viruses, and the residual where it affects the brain function. It can be athletic injuries, bones that have been infected, osteomyelitis that aren't healing quickly. So there's a whole host of things where increasing the oxygen to the tissues will improve the patient's condition.
So why does it improve the patient's condition? Like, what's happening here? Is it a mist that's coming out with chemicals, or explain to the viewers a little bit about kind of what's going on in there, and why it's so beneficial for so many different kinds of issues.
Yes. Well, what we have is a hard-sided chamber.
And actually, I'm going to have Valerie's behind the camera, being amazing. Valerie can kind of come up close, and you can get some video while he talks. And I'm going to actually go underneath and out of the way. So, Valerie, if you want to walk up, whatever, so that the viewer can kind of see while he's talking.
Yeah, it is a hard-sided chamber where it's filled with 100% oxygen under pressure. And that pressure may vary from 1.3 atmospheres, which are shown by the gauges, up to 3 atmospheres. 3 atmospheres is equal to 66 feet underwater.
Wow.
So in 1 atmosphere is 33 feet underwater, and we on Earth, as we're standing here, are at 1 atmosphere, and that's due to the pressure from the air above us. So when this happens, that you're breathing 100% oxygen under pressure, it fully saturates the blood vessel that carries oxygen to the tissue 10 to 15 times more than normal. Normal delivery of oxygen is by the hemoglobin, which is the red blood cell. Well, in this case, the whole vessel carries oxygen, including the red blood cell. That's how you get greater oxygen delivery to the tissue. It stimulates metabolism. It helps create new vessels to areas that are damaged, and it helps healing of the cell. It stimulates the cell's healing process. So how that works with the unit is, behind us is a bed that's on a gurney. Patients lie down on the bed. The bed slides in on rails. The patient has a TV they watch.
That's pretty fun.
Which is outside the chamber, or they can listen to music, or they can sleep. And once the patient slides in, you have to seal the chamber with closing the door, which some people have trouble with that are claustrophobic. But as you can see, it's all enclosed in a clear acrylic so
Yeah.
you can see out. So that's usually not a problem. And then you're pressurized slowly, which would be what we call a dive, where you'd be like going down underwater. It's similar to descending from altitude to ground level in an airplane.
Yeah.
And so it's a gradual increase in the pressure. You're able to clear your ears.
I was just going to ask about that ear pressure.
Right.
Always think
Some
about
people may have a little trouble, but we have earplugs that are special earplugs to help with that. And if that doesn't work, then you can have ear tubes put in, which solves the problem.
That's great.
And so that's a solvable problem. Once then you're under pressure, you breathe the 100% oxygen normally. And it's not from what is forced through the tissues, as we said, it's what you breathe in and then what your blood vessels carry to the tissues for healing.
So should you try to be taking deeper breaths, or is it just you kind of just act and relax normally?
Just acting at that point, and it's delivering the healing qualities of oxygen to the tissues in greater concentration. And it's like rehab. In other words, it's just not magic that all of a sudden everything is great. It evolves over time because it's a healing process. It's a metabolic process that occurs. And it helps the liver function better. It helps the heart function better. The kidneys function better. The brain function better. The muscles, the nervous system. So it affects all parts of the body, even though you may only be dealing on a wound in case of a wound, or the brain in case of traumatic brain injury, or the nervous system in the form of a toxic neurological exposure, either from a chemical or a mold toxin.
So you're saying kind of it makes all these the parts of the body feel better. Can people come and take a look and learn more about it and get more information, and even come and use the chamber if there isn't a very serious ailment? Can they come just to kind of better their livelihood, I guess?
Exactly. And we do have patients that come for health maintenance reasons.
Great.
It helps detoxify. It helps the brain work better. We have attorneys that come and do it to sharpen themselves up.
Wow.
We have people that have had injuries in the past that do maintenance with it to keep themselves healthy.
Wow.
So the answer is to your question, yes. You can find more about it at the website, Hyperbaric Centers of Texas.com.
Yeah.
You're welcome to call our office to get more information. And also, we have people come by and visit. It is a medical device, and it's supervised by a licensed physician, and so you have to have an order from a physician to do it. So I will see you, figure out what works best for you. There's all kinds of different protocols depending upon what we're treating, and make that specific protocol up for that individual patient so they get the most benefit for the time spent.
Absolutely. All right. Well, I know we have to keep this kind of short because they're live right now. They have patients, kind of going in and out. Is there anything else that you think people would want to know, or a lot of questions that you get?
I don't think so. You've asked most of the questions. There's a variety of things that it can help. So go to the website, take a look at it. There's a whole list of off-label uses as well as the on-label uses. We have patients that their insurance may not pay 100% for the hospital. Many times the cost of doing hyperbaric here is less than the deductible that you have to pay at the hospital.
Wow.
So we have people that may be candidates at the hospital, but it's cheaper for them overall to do it here. Most or all the off-label uses are cash pay basis. So take a look at the website, and happy to answer any questions. There's an email address on the website that you can ask questions.
Yeah. Awesome. That's perfect. And we also, of course, have everything tagged right above in this video so that you can find out all of the information as well. Dr. Johnson, thank you so much.
You're welcome.
All
My
right.
pleasure.
Well, we'll see you later.